Welcome to our virtual event, Practical Tips, Mentally Healthy Workplaces During COVID-19. Thank you for joining us. My name is Michael Pogorzellik. My background is in pharmacology and microbiology. I'm a certified health and safety consultant and work as a prevention consultant at SafeWork Manitoba.
Hi, Mike. Great to be doing another webinar with you. My name is Jennifer Dick. My background is in nursing, and I'm a certified occupational health nurse and prevention consultant with SafeWork Manitoba. SafeWork Manitoba is a division of the Workers' Compensation Board and is the public agency dedicated to the prevention of workplace injury and illness. Working with our partners in the safety community, we provide prevention education, safety programming, consulting, and strategic direction to create a genuine culture of safety for all Manitobans.
We'd like to go over a few housekeeping items. In an effort to ensure we comply with public health COVID-19 protocols, including physical distancing, Jen and I are presenting from our own homes. Some of this presentation has been pre-recorded to ensure we are able to deliver clear information. Some of the information may have changed since we recorded this session. There will be some live portions, including polls, where we ask for your participation. Please use the Q&A box if you have any questions or technical issues during the presentation. We will do our best to respond throughout. If you're unable to give an accurate response right away, following this presentation, we will compile all questions, take the time to research the answers, and post the responses to our website. The recording of this presentation will be posted at a later date on the SafeWork Manitoba YouTube channel. It is important to note this presentation provides advice of a general nature. It is not a substitute for legal or health advice and should not be relied on as such. Viewers should seek their own legal and health advice and/or follow workplace procedures as appropriate.
Thanks, Mike. Let's start with a poll. What industry are you currently working in?
Thank you for participating in the poll. We have diverse representation of workplaces across all industries, especially from healthcare.
Next, we will check out SafeWork's new campaign about mental health in the workplace, which speaks to various industries.
No matter what industry you work in, mental health matters. Because each year, 1 in 5 Manitobans will experience a mental health concern or illness. Let's work together to build healthier workplaces, physically and mentally. Find community resources at safemanitoba.com.
That's a great campaign, Mike. Thank you for sharing. We know that COVID-19 has had a significant global impact. To briefly recap COVID-19, we know that COVID-19 is caused by a virus named SARS-CoV-2. First detected in late 2019, SARS-CoV-2 has turned into a global pandemic, which has now infected people in most countries around the world. It is a new virus that is passed between individuals who are infectious, who may not be showing symptoms, have no symptoms, or before symptoms occur. As soon as the virus was detected, scientists started to develop a vaccine. In recent months, this vaccine has been approved and is currently being rolled out to Manitobans. Although we have a vaccine, the months of isolation, change in work environments and practices will have taken a toll on our coping mechanisms and our mental health. We have experienced new realities: working from home, unemployment, changes in our workplace, school closures and childcare issues, being isolated from family and friends, and new coworkers being our kids, pets, or spouses. Adapting to these changes are challenging and may impact our mental health.
Thanks, Jen. To start our discussion, let's begin with some definitions to make sure we are all on the same page. As we can see here, based on the Canadian Standards Association's definition of mental health, being mentally healthy allows us to understand how to cope with normal stressors of life. As we heard in the new campaign video, a reality is that 1 in 5 of us will experience a mental health issue in our lifetime. During the COVID-19 pandemic, I think it's safe to say that we have experienced a change to most aspects of our daily living, with each of us experiencing varied emotions. It is important to realize these emotions can be experienced both in our personal and work life, now more than ever. Let's do another poll. What is one reaction to the pandemic that you have heard the most?
Thank you for your participation. And some of us may have heard all of those reactions being discussed. COVID-19 has really set a landscape of being distanced from people, being in our household, and only going out for essentials. This can affect everyone differently, but here are some examples of reactions an individual may experience at work, wherever that workplace might be. Some of us are trying to navigate a new way of working, whether that is at home, in a manufacturing plant, in a healthcare center, or any other workplace. We might see someone who is struggling at this time or at any time. As we can see, an individual might experience loneliness, anger, irritation. Someone might also be in denial with the way they are feeling. This can be seen as nervousness or anxiety, decreased motivation, or feeling tired due to the lack of sleep. Someone might also become overwhelmed. In the workplace, we might see that a worker also feels lonely. Workers might be confused about how to feel with the restrictions or uncertain about how to follow them. A worker may be late for work because they're feeling tired or having trouble sleeping. They may miss time from work or be at work but not very productive. They used to always have quality to their work, but this might also be changing. They may miss deadlines or not be able to meet the expectations of the job. They may also feel mistrust, that the workplace doesn't have their best interests in mind. We may have even seen these reactions pre-COVID. What's important to understand is that we can support each other because these reactions are influenced by many factors, either personal or workplace.
As Jen mentioned, it's important to realize that factors around COVID-19 can impact people's mental health and their ability to cope in different ways. These factors include our past experiences. Some of us may have dealt with similar situations to this before, whereas with others, the concept and the factors around a pandemic is completely new. In addition, others may have had previous trauma in their lives and may experience stress differently. Concerns over how we are going to respond to COVID-19. This can increase our anxieties around catching and spreading the virus. Necessary public health restrictions. These have impacted our ability to see loved ones or friends. This may cause an increased sense of loneliness and may make coping difficult. And types of workplaces. For example, different emotions may be experienced during this pandemic if you are an essential or non-essential worker. It is important to realize that these factors influence people's reactions and during this pandemic may translate to hazards within the workplace.
Thanks, Mike. The COVID-19 pandemic has also changed the way we work. These are not necessarily new, but COVID-19 brought these into focus. Some of these may be taking care of personal and family needs while working, which may lead to conflicts around lack of childcare and may impact our work-life balance. Hours of work and pace of work, which may have increased or decreased. Work expectations may not be clear, which may leave you feeling guilt for not contributing enough. Or adapting to a different workspace, for example, those working from home. Finally, learning new ways to communicate, for example, virtual, where some may experience some technical difficulties. Employers can address these workplace psychological health and safety hazards by implementing the recommendations found in the CSA standard. We aren't going to spend a lot of time on the CSA standard today because our goal is to bring you some practical tips in the workplace. This standard can be found on our website, and I encourage you to read and understand this. A course offered by the Canadian Mental Health Association, A Hazard is a Hazard, is also a great course that can be taken to gain a better understanding of the standard.
Thanks, Jen. Our goal today is to bring you some practical tips that can be used in the workplace to support mental health during the time of COVID-19. For the remainder of the webinar, we would like to talk about mental health topics and provide you with practical tips for each. We will speak to the following topics. Topic number 1, workplace culture. 2, combating stigma. 3, assess the risk, mental health. 4, communication strategies. 5, conversation starters. 6, training and awareness. 7, pandemic fatigue. 8, self-care. 9, resources. And 10, what to expect after COVID-19. I will now pass it on to Jen to discuss topic number 1, workplace culture.
Thanks, Mike. So what does culture mean to you? What was your workplace culture like before COVID? Culture is key to this presentation. Culture is a set of values and beliefs, a way of doing things. It can drive a positive work environment, but it can also foster poor work morale. A positive workplace culture takes time to create. One person can make the difference. I have seen many environments where culture is positive and it shows in the morale and environment. Workers are happy, they are laughing, they are a team. While a negative working culture might look like the complete opposite. A recent global study by the Tanner Institute studied the impact of COVID-19 on a thriving culture and a non-thriving culture. As we can see in the chart, a thriving culture before COVID had very little change. A thriving culture actually helped to keep workers engaged, retained, included, and satisfied. 13% of workers experienced burnout, which is significant, but looking at the rates in a non-thriving culture, we see that the rate of burnout increased to 81%, while engagement, retention, feelings of inclusion, and overall satisfaction all decreased by approximately 50% in a non-thriving culture. COVID-19 has challenged most workplaces to find alternate ways to keep employees engaged in an effort to maintain and/or build upon culture. If you had a poor culture before the COVID-19 pandemic, it might be more difficult to build it while being away from the workplace or when having to change the way work is being done. An assembly line with barriers or more space makes it more difficult to have conversations with each other. Team building events, which were helpful in bringing people together, might be done virtually without that in-person interaction. How has COVID-19 impacted your workplace culture, and what can you do to support it?
That's really interesting, Jen, to hear that study. It really demonstrates how important safety culture is to the workplace. Public Services Health and Safety Association provided the following tips that you can use to improve your health and safety culture around mental health. Visible commitment from management. Commitment to mental health and safety in the workplace by management must be visible to the workers. This can be achieved by having open communication and providing access to mental health related resources and supports. Organizational transparency. Throughout the COVID-19 pandemic, organizations have had to adapt to this situation. In some organizations, this may have required a large change in the way they do business. For example, working from home, staff turnovers, or even possible layoffs. To maintain a positive culture around mental health, it is important for the organization to be transparent during these uncertain times and engage the entire workforce. This can be done by sending company-wide emails, conducting surveys, and requesting feedback. And finally, the organization needs to continue leading and striving for improvement around mental health. This may include organizations reviewing and implementing up-to-date standards or best practices, such as the CSA standard on psychological health and safety in the workplace. As Jen mentioned, a thriving workplace culture will be more resilient through this pandemic, especially when it comes to mental health in the workplace. If your organization is interested in finding out how your workplace safety culture is doing, you can utilize our safety culture assessment tool, which can be accessed through the Safe Work Manitoba website.
Those are some great tips. Thanks, Mike. We will now move into combating stigma in the workplace. Stigma in the workplace has negative impacts on psychological health and safety. It not only impacts the worker, but also the workplace. Take a moment to reflect on how you might respond to someone being diagnosed with COVID-19 in your workplace. Or maybe you've already experienced this. We are not privy to who has been diagnosed, only if we need to isolate or self-monitor. After getting tested and perhaps having a positive test, were you treated differently? At the beginning of the pandemic, we heard Dr. Rusin ask Manitobans to avoid stigmatizing. Stigma was seen in industries working the front lines or workplaces with outbreaks. It is important for Manitobans to break down these barriers to ensure we are treating each other fairly and with respect. A positive COVID test in the workplace is scary, but think about how scary it might be for that worker. Stigma can also create barriers to seeking help or accessing help. The isolation around COVID-19 can also be a factor. If someone is struggling with feelings of stress, burnout, anxiety, or depression, they may not seek help out of fear of being stigmatized. Mike is going to give us some really important tips on how to ensure we are breaking down these barriers.
As Jen mentioned, mental health stereotypes and stigma, unless addressed, will be a major barrier to moving forward when addressing mental health and safety concerns in the workplace during the time of COVID-19. Some practical tips include awareness, ensuring your managers and employees have a basic awareness of factors affecting mental health and well-being. This includes debunking myths and stereotypes around mental health. For example, the myth that mental health conditions affect everyone in the same way, whereas we know this is incorrect because individuals may experience symptoms differently. We need to be aware of the potential signs of mental health conditions and encourage people to seek help from professionals. Writing and revising a respectful workplace policy. Workplaces should ensure that the policy is up to date and that the workers understand it. Workers should also be aware of where the policy is located should they need additional information. And fostering a mentally healthy and safe workplace. By establishing a culture that is conducive to supporting employees' mental health. This can include employee assistance programs and training managers to support employees who may be experiencing mental health conditions. Next, Jen will take us through topic number 3, assess the risk, mental health.
Thanks, Mike. COVID-19 has taken the world by storm, a global pandemic that has challenged our health systems, and our economy. We know that the hazard of COVID-19 is a biological hazard that is invisible. But what about the psychological hazards that we are encountering every day? We told you about these hazards in the beginning of this webinar. One example is the hazard of hours of work. If we take healthcare as an example, many of our healthcare workers are working long, hard hours, double shifts, extra shifts. How is this impacting our healthcare workers? We have seen how this is leading to burnout, and more recently, we've seen how the pandemic has led one physician in Quebec to suicide. Assessing mental health risks is needed to make sure we are protecting workers in all workplaces. Mike and I are going to show you how you can assess a risk, but first we will start with a poll to open our exercise.
Thanks, Jen. When looking at this picture, what type of psychological health and safety hazard may be present?
Thank you for your participation. The answer is work-life imbalance. Mike will now speak to the elements of a risk assessment and controls.
Thanks, Jen. Now that we have identified the hazard as work-life imbalance, we can now assess the risk using the elements of a risk assessment to prioritize next steps. These elements include severity of consequence, probability of occurrence, and frequency of occurrence. Based on the work-life image we saw, the severity of consequence can be burnout, which may require medical treatment and time off work. The probability of burnout occurring could be considered likely as the person's work environment has now become their home environment, and it may be difficult to separate between the two. The frequency can be considered often, as this person may be facing the situation numerous times throughout their work week. So how can we address the hazard and reduce the risk of its occurrence? To address this psychological health and safety hazard, we can use the hierarchy of controls. Based on the hierarchy, we can eliminate at the source. This may include job reassignments and/or setting overtime maximums. Utilize administrative controls. This can include altering the way work is done, redefining job tasks and roles, adjusting work schedules, and being flexible. And lastly, at the worker level, including resiliency training, mental health awareness, self-care, and effective communication training. Jen will now cover communication strategies which you can use to create a mentally healthy and safe workplace.
Thanks for reviewing how to assess the risk, Mike. We will now move into communication strategies. This is one of my favorite slides. We know that communication is often key to creating a positive work culture. When workers receive clear communication on what to expect and clearly understand what is going on, they may respond better. Having clear expectations creates an environment where workers know what to do and how to respond. We see this throughout the pandemic. We've all had to adapt to make sure we follow the fundamentals. Staying 6 feet apart means that lunches look different, breaks look different. Even work looks different, as we might not all be able to be in the workplace at the same time. This is also true as we return back to the workplace. Understanding what to expect may help to alleviate the anxieties that some workers might be experiencing as workers either return back to the workplace or or more workers are entering the workplace. We know that the vaccine is going to take time to roll out, and that although more and more workers will be vaccinated, we still need to practice our fundamentals. Perhaps workers might have questions surrounding the vaccine. For example, I don't know if my coworkers are being vaccinated. What do you do? What should your leadership say? These are all questions and items that should be communicated effectively to the workplace. Your workplace should seek their own legal advice and review workplace policies. Communication around this in the workplace will also need to be acknowledged. As part of communication around mental health and COVID in the workplace, it's also important that we know how to start a conversation. Sometimes it's difficult to know what to say to someone. It can be hard to find the words. Mike and I have taken the communication strategies and added in some conversation starters to help you, courtesy of the Mental Health Commission of Canada.
So to summarize, how can you help someone in mental distress? The Mental Health Commission of Canada recommends these 5 communication tips. Tip number 1, approach and assess. Invite the person to talk. If there is a risk of suicide or harm, ensure you reach out to first responders.
We might think about starting our conversation by saying, I've noticed that you say you are sad. How are you doing? How long have you been feeling this way?
Tip number 2, listen without judging. Help the person speak freely by listening and asking questions without judging or telling the person what to do.
A good way to start this conversation is to reiterate what the person is saying without judging them. It sounds like you're really worried about your job. Is that right?
Tip number 3, give reassurance. This helps to counter any shame associated with mental distress, reluctance to talk about, or reluctance to reach out for help.
As Mike mentioned, this is a hopeful message and provides reassurance to the person you're speaking to. A good way to start this conversation is, given the situation, it is understandable that you are experiencing this. There are supports available that have helped others.
Tip number 4, encourage other supports. Help the person to find ways that others can support them during this time.
Asking the person if they have any additional supports is a good way for them to reflect and remember that they can reach out within their family, friends, or community. A good way to start this conversation is, how might a family member, friend, or community member help?
And finally, encourage professional help. Help coworkers to identify appropriate professional supports.
As Mike said, ensuring that a person knows that there is professional help and encouraging them to seek professional help. This can be done by saying, who has helped in the past? Would it help to call your family doctor or mental health specialist? Although someone wants to help, there are times when they do not know what to say, and because of that, they may not say anything at all. These conversation starters can be helpful to keep in your toolkit so you can open the door to communication. You never know, you could be the person that helps a colleague get the help they need.
We've just told you about the importance of communication around mental health and COVID in the workplace. We've also given you tips on what that might look like. Here's a short video from CCOHS to summarize.
Life can be stressful.
It can be hard to cope.
But the workplace can be a place of support.
A place of healing.
Reach out.
Check in. Speak up.
Show you care.
Start with a question.
Are you okay?
Hey, you alright?
You okay?
A few simple words can make a big difference.
Comfort.
Support.
Reassurance.
You're not alone.
Many of us have been there before.
Mental.
Or physical.
Illness is illness.
So go ahead.
Start the conversation.
Hey man, you okay?
That is a great video. Thanks, Mike. It is important to understand and be able to process what's going on in the world. Seeking out credible resources and training opportunities is important for workplaces. This might come in the form of formal training, a course, a webinar, or a website resource. Be sure to note that the information you are seeking is from a credible source. Being armed with this reliable information allows employers to know what to say to workers who may need help. It will also be helpful in building your psychological health and safety program, which includes a review of the CSA standard and the 13 psychosocial factors. Mike, where can I find information on training opportunities around mental health?
As Jen mentioned, being armed with reliable information allows employers to know what to say to workers who may need help. Remember, a hazard is a hazard, whether it be physical, ergonomic, biological, chemical, or psychological. A psychologically healthy and safe workplace has the systems in place which consider what may cause mental injury, how these hazards can be controlled, and if something happened, what corrective actions can be taken. For more information and training on how to build awareness about psychological health and safety in your workplace, especially during this time, you can attend A Hazard is a Hazard, Workplace Psychological Health and Safety, by registering on the Canadian Mental Health Association website. In addition, you can access additional information on psychological health and safety through the Mental Health Commission of Canada, your associated industry-based safety program, Safe Work Manitoba, and Manitoba Federation of Labor Occupational Health Centre.
Thanks, Mike. We will now move into pandemic fatigue, and I think most of us can relate to this slide. I think a lot of us might be feeling fatigued and maybe having difficulty. The World Health Organization defines pandemic fatigue as a natural and expected reaction to sustained and unresolved adversity in people's lives. It expresses itself as demotivation to engage in protective behaviors and to seek out information. As we know, COVID-19 has changed most aspects of our lives. We have had to isolate, follow prevention measures, and be away from loved ones. A recent Ipsos poll found that although most Canadians are cooperating with public health and safety measures, pandemic fatigue is growing, with about half of Canadians saying they're getting tired of following public health rules around COVID-19.
Thanks, Jen. Workplaces can manage pandemic fatigue by promoting mental health and ensuring physical safety, both of which will help continue to prevent the spread of COVID-19 in your workplace. Actions the workplace can take include promoting free mental health supports, including community resources, employee assistance programs, and Ability CBT. Keeping the lines of communication open between management, workers, and coworkers. Help workers stay connected to each other in safe ways, for example, daily or weekly Zoom calls with your team. Being self-aware of your own mental health to avoid burnout, and staying positive and being a good example by following your workplace prevention measures.
Thanks, Mike. Those are some really great tips. We've all heard about self-care and the need to practice self-care now more than ever. This is also true as we are working in varying environments. Some workers may have experienced a job change or alteration of duties. Some might be working longer hours with an increased need for concentration. It is difficult to take care of others if we aren't practicing a healthy lifestyle. Self-care comes in all forms. It is also important to practice self-care while working, taking assigned breaks and lunches, using a break to connect with colleagues or get some physical activity. COVID has created an environment where we have to be apart from people, but it doesn't mean we have to sit in isolation. We have the ability to be outside, but just adhering to public health guidance. We can also connect using other means of communication. Mike, can you give us some tips on how to practice self-care now and in the future?
Sure, Jen. While it is important to provide mental health supports to your workers during this pandemic, it is also essential that you be mindful of your own mental health. Tips for self-care include set limits on the amount of screen time. For example, time limits on accessing this news or social media. Stay connected with family, friends, and coworkers through email, phone, or virtual platforms, and make sure to laugh. Laughing can elevate your mood and boost your immune system response. Exercise regularly and eat healthy. Practice stress reduction techniques, which can include meditation or yoga. Set boundaries, pay attention to how you're feeling, and maintain a work-life balance and seek help if you are struggling. Check out the Safe at Home Manitoba website where you can access links, online events, and learn about government programs, including a virtual trip to the beach for some island tunes. Jen, can you direct us to some mental health resources and supports?
Sure, Mike. As you can see on this slide, there are many resources available. To name a few, Manitoba Health has virtual counseling offerings and online learning modules, while many employers also have an EAP program. You might also consider checking out local community health clinics or other resources from the Canadian Mental Health Association or Occupational Health Centre. The World Health Organization, Public Health Agency of Canada, and Health Canada all have several online resource materials. You can also check out your industry-based safety program for more information. You can get a link to your IBSP and other information on our website at safemanitoba.com. Please also remember that crisis lines are also available 24/7. Mike, this is a sampling of all the great mental health resources currently available. Can you tell us how we might ensure we are looking at credible information when we do an online search or view other information?
Sure, Jen. It is important to remind workers that they have mental health supports and resources available to them. These include informal supports, such as one's family and friends, as well as formal supports, including employment assistance programs. The worker needs to be aware of how to locate and access these resources and supports and ensure they are reading credible information, especially when it comes to COVID-19. When accessing what is credible, the World Health Organization has laid out these steps to take to flatten the infodemic curve. Assess the source. Ask questions like who shared the information with you and where did they get it from? Remember to vet the source. Go beyond the headlines. Headlines may be intentionally exaggerated to increase views. Read more than just the headlines. Read the entire story. Check the date. Ensure you are reading up-to-date material. And check your biases. Biases affect how we view what is happening around us. Always remember to evaluate your own bias and why you were drawn to the news article in the first place. For the majority of this webinar, we've been focusing on mental health during the time of COVID-19. However, the end of this pandemic is starting to come into view. So the question becomes, how will mental health be affected after COVID-19? Jen, can you talk about what to expect after COVID-19 and how it may impact our mental health?
Sure, Mike. I think we can all agree that we have a curiosity about what life after COVID will be like. Will we always feel the need to be distanced from people? Will we see more mask use? Will there be more mental health issues because of the significant amount of time we have spent apart? Returning back to full capacity at work might be very difficult for some. Some of us have been working from home for months. We've become used to being alone during the day. What about the workers who are now need to go back to a cubicle? This may be difficult. The distractions become different. We might see a shift in work arrangements, or we might see requests to be accommodated with working from home. These are all going to be dependent on the employer. We will also need to see an environment that fosters support and kindness. The months after we all return to our workplaces might challenge us as we adapt to new routines. For the truck driver, there might be more vehicles on the road. For the salons, haircuts and colors. Restaurants will be packed with friends, and travel agents might be overwhelmed by all of the people needing a break. We need to acknowledge that the pandemic may have led to burnout. Essential workers are working overtime and busier than usual. What is your workplace doing about burnout? There will also be a need to consider our work-life balance. For those who are driving to and from work, it might take longer with more cars on the road. Activities for the kids will be on and we'll again be rushing to the next appointment. We need to take time to ensure we're creating and maintaining the balance.
Thanks, Jen. We have just entered a new year, and with it comes new goals and ambitions. However, 2021, just like 2020, won't be like most years, and we'll have to adapt to this new reality. The Mental Health Commission of Canada gathered these tips from clinical psychologist and University of Calgary professor, Dr. Keith Dobson, to help you set goals in a year of uncertainty. Focus on the short term. Focus on the short-term goals that will help build self-esteem and promote mental well-being. For example, exercising a set number of times per week. Leave room for the long term. You should also leave some room for some long-term goals while focusing on the short term. This will provide hope, and foster optimism for the future. For these goals, avoid firm deadlines, as the pandemic may require us to adjust these goals. An example would include volunteering when public health measures allow. You want to balance pleasure and purpose. Goals related to activities that bring you joy are just as important to those based on achieving success. By balancing the type of goals, you will be more likely to enjoy the journey. Align goals with personal values. Aligning goals with your values may add more meaning to them. For example, if good health is a goal and aligns with your values, improving your physical condition may be more rewarding than pursuing a promotion at work. And finally, give yourself grace. Set modest goals and be gracious with yourself if you come up short, especially during the time of this pandemic. Remembering setting goals is about working towards self-improvement, and the effort is what matters most. For our last poll, to conclude this webinar, who has the greatest responsibility to maintain and support a psychologically healthy and safe work environment?
Thank you for participating in our final poll. The answer is A, employer, but we all have a role to play. Let me summarize this presentation for you. We have given you 10 topics to consider as we think about being mentally healthy in the workplace. We've shared tips on how employers might want to think about creating an environment and culture of psychological health and safety. Be sure to be aware of your own feelings and understanding of others. Be sure to practice self-care and encourage your coworkers to do the same. Use credible information and communicate with kindness and compassion. Remember, we all have a role to play. Although the employer has the largest role in keeping everyone in the workplace safe, physically and mentally, if we all work together, we can achieve a healthy environment. To finish our presentation, here's a short video to show you how a fellow Canadian deals with self-isolation.
Hi, I'm Chris Hadfield. I've spent a little time self-isolating on board a spaceship. How are you doing with self-isolation? You know, it's an extremely dangerous environment up on board the space station, and yet we find a way to thrive and be productive that far away from our normal lives. We do it through 4 different things. Number 1, understand the actual risk. Don't just be afraid of things. Go to a credible source and find out what is truly the risk that you're facing right now. You, your family, your friends, the people that you care about. And then, what are you trying to accomplish? What are your objectives? You know, what's your mission for right now? Make that clear for this afternoon, for this week, for the next month. What do you want to get done? Then look at your constraints. Who's telling you what you need to do? What financial resources do you have? What are your obligations? But once you understand the risk and your mission, your sense of purpose, and your obligations, then take action. Start doing things. They don't have to be the things that you always did before. Take care of family, start a new project, learn to play guitar, study another language, read a book, write, create. It's a chance to do something different that you've maybe not done before. And then repeat. And of course, if you think you've been exposed to COVID, then, you know, if you've gotten closer than a couple arms length to people, then self-isolate. And if you have any symptoms, you know, a sore throat or a fever or a cough, then consult a physician. But there's never been a better time to self-isolate. So many people have access to the internet that you have the entire written work of everything, all the body of knowledge right there at your fingertips. So take care of yourself. Take care of your family. Take care of your friends. Take care of your spaceship. And I wish everybody happy landings.
What a great video from a fellow Canadian and someone who understands isolation. We will now move into some questions and answers. These are some questions that we have received in recent weeks around mental health in the workplace. Jen, can you answer this question for us? Some workplaces post-COVID might look very different, while others will remain the same. How can a workplace start to think about engaging the workers after we start to go back to regular duties?
This is a great question, Mike. We talked to you about setting goals. Leaders could start to think about what to do at the workplace. Maybe this looks like pizza lunches or regular toolbox talks about mental health or self-care. Maybe this is a wellness campaign focused on building a psychologically healthy and safe workplace. Whatever this is, a workplace can start to think about long-term goals. In the short term, think about how to engage workers to build a positive workplace culture. Mike, for our second question, can you tell us how I might ask someone if they are okay?
We shared tips 4 and 5 related to communication. Communication and having conversations is not easy to do. Some might not feel comfortable with asking a coworker if they are okay. Start small and simply ask, "How are you?" Sometimes just asking a simple question can start to build a relationship of trust. Just letting someone know that if they need anything, you can be a trusting colleague. This might be even more difficult when we are not in a workplace, but we've also told you about virtual options and that you can talk to people over the phone, Zoom, or any other platform. For a final question, Jen, is there any legislation around mental health in the workplace?
Another great question, Mike. The legislation requires workplaces to provide a safe and healthy workplace. This is in the general work statement. As well, having a respectful workplace free of violence, harassment, and bullying. Workplaces might also consider using the CSA standard as a tool to help in creating a psychologically healthy and safe workplace. The CSA standard might not be enforceable, however, it does provide an opportunity to build a really strong culture of psychological health and safety.
Thanks, Jen. That concludes our presentation on practical tips, mentally healthy workplaces during COVID-19. If you have any additional questions, please do not hesitate to connect with Jen or I.
On behalf of Safe Work Manitoba, thank you for watching our virtual presentation. We hope you were able to take away some tools and knowledge to better understand how to be mentally healthy during COVID-19. We hope you were able to take away some practical tips. In the coming days, you will receive an email with a link to a list of resources, Q&As, and a survey. You will also be able to view the complete recording of this webinar and share it with your colleagues. Please be sure to visit safemanitoba.com to view resources and take the COVID-19 best practices for a safe workplace training to learn even more about keeping yourself and your workplaces safe and healthy. The following slides contain the references we used for the webinar. Thank you so much for joining us.